Hi, my name is Tal and welcome to this short presentation about the thyroid and weight gain connection. In this short presentation, I'm going to discuss one out of the 5 major root causes that contribute or lead to weight gain and obesity. Until recently, we believed that weight gain is just a result of eating excess calories and not exercising enough. But we know now, based on multiple studies that have been coming out, that changes to our metabolism happens because of several factors that slow down our metabolism, leading us to excess weight or obesity. And in this video, I'm going to be talking about how the thyroid dysfunction or imbalance to the thyroid hormones can aggravate or contribute to weight gain. This is a topic that is unfortunately not discussed in the mainstream medical approach. Now, if you're interested in going deeper and learning about the 5 major root causes that lead to weight gain and obesity, learning the evaluation process, including the functional specialty lab testing, and learning about the specific evidence-based treatment protocols from clinical nutrition and herbal medicine, then I invite you to our comprehensive and live functional weight loss summit that is taking place later on this month. In this summit, we're going to have multiple functional and nutritional medicine experts that will be teaching you the evaluation process and the tools to help your patients to reduce their excess weight and to offer unique weight loss programs in your practice. I look forward to seeing you there.
Now, just as a review, most of you already learned this, perhaps recently or perhaps years ago. The thyroid system works in a very simple way. The hypothalamus is producing the thyrotropin-releasing hormone, which stimulates the anterior pituitary gland, which synthesizes thyroid-stimulating hormone, what we refer to as TSH, and then that stimulates the thyroid gland to produce the thyroid hormone T3 and T4, and from there, most cells in our body are going to be stimulated mostly by T3, which is the active hormone. The thyroid gland mostly produces, as we mentioned, mostly T4, so it could be up to 90% T4 and small amounts of T3. Most of T3 and 4 is bound to proteins that are inactive, except for free T3 and T4 in our blood. And T3 is highly active. However, it is present in significantly lower amount than T4. So only about 20% of the T3 in a peripheral tissue originates from the thyroid glands. Up to 60% of T4 is converted, as you can see in this simple drawing here, converted by an enzyme called deiodinases found in our liver, kidney, central nervous system, and muscle, which is a little hint in which if some patients have problems with their metabolism or dysfunction of the liver, kidney, that might to some degree, and even gut, might to some degree interfere with their conversion of T4 to T3. So remember, the peripheral conversion is where our body utilizes most of the T3. And that's basically plugs in, like you see in the drawing here, plugs in into the receptor and stimulate the cell's metabolism. Now, there's going to be enzymatic conversion of T4 to T3, and that requires selenium. So remember that as an essential nutrient, and we're going to get to selenium and different dosages and how you can use selenium clinically. And there is association between low levels of T3, T4 ratios and reduced selenium in our red blood cells. Now, interestingly about thyroid, you might see more thyroid patients than you think, and maybe that they think, because 60% of those with thyroid disorders are unaware of their condition. And in many cases, what we refer to as subclinical hypo or hyperthyroidism are unfortunately not diagnosed by their primary care providers. And women are 5 to 8 times more likely than men to have thyroid problems. About 1 out of 8 women will have a thyroid condition. Undiagnosed thyroid disease put patients in risk for certain serious conditions, such as cardiovascular diseases, osteoporosis, infertility. Pregnant women with undiagnosed or inadequately treated hypothyroidism have an increased risk of miscarriage, preterm delivery, and severe development problems in their children. And so we're looking at about 20 million Americans that have some form of thyroid disease. Some statistics referring to those numbers as 1 out of 10 Americans will suffer or are suffering from thyroid condition in their lifetime. So how might you identify if the patient that you're working with has thyroid disease? So when we're looking at deficiency of those thyroid, remember, because thyroid hormone, especially T3, stimulates every tissue in our body. So if there's less thyroid hormones and there's less stimulation, the metabolism slows down. So while you might see dry skin, slower thinking, decline in memory, some patients refer to it as brain fog, depression, cognitive impairment. One of the main signs and symptoms we're seeing is weight gain, or patients that describe that even though they are dieting or reducing calories or introducing more exercises, they're not losing weight. And so that's because their own metabolism is slowing down. Muscle weakness or cramps, fatigue is very common in both hypo and hyperthyroidism. Cold intolerance is something that is quite often seen with those patients. That could be cold extremities. For example, they complain that their toes or fingers are feeling cold. And that could also be hair loss is also very common, and decreased kidney function. That's with very prolonged hypothyroidism. They sometimes have puffiness under their eyes just because the impairment of metabolism fluids, and also they tend to be constipated. Subclinical low thyroid function is associated with insulin resistance and diabetes. The slower metabolism can lead to different issues, and that includes the fatigue that they're experiencing, the weight gain, and also insulin resistant is sometimes also seen. So when we look at thyroid and weight gain, we have to remember that about 30% of our rest energy expenditure, our basal metabolic rate, is regulated by thyroid hormones. And if a patient has a deficiency of those hormones, they're going to slowly gain weight or struggle to remain in that healthy weight range. There is association between thyroid hormone and obesity, but when you look at overall research and clinical studies that are viewed, there are conflicting results. Some studies show that there is an association, some report that there isn't. The peripheral thyroid hormone, T3 and T4 and TSH, are moderately increased in obese children, and overconsumption of calories may be associated with an increase in total T3 and decrease in reverse T3. So unfortunately, in the last 50 years, portions of foods that are served in restaurants and the amounts of calories driven by processed food and sugar has just been increasing dramatically. So most of us consume much more calories than our grandfathers used to use or consume years ago, right? Now, treating obese patients with low-calorie diet might lead to reduction in thyroid hormones and thyroid function that resembles sick thyroid syndrome, which is basically a reduction of T3, T4 caused by inflammatory cytokines.